I'm Susan Davidson, the CEO of the Australian Diabetes Educators Association, also known as ADEA. We are the peak national body for diabetes education in Australia. We accredit credentialed diabetes educators who are specialists in diabetes education management and care. And we also provide training for all health professionals in diabetes. Because it's really important that all health professionals understand diabetes, can recognise the signs and symptoms, given that around 25% of people presenting in healthcare settings actually have diabetes. There are approximately 1.5 million people in Australia living with diabetes and, in fact, diagnosed with diabetes, and another 500,000 estimated to have silent, undiagnosed type 2 diabetes. Of these, we've got around 140,000 with type 1 diabetes and 1.3 million with type 2 diabetes. And around 65% of all people living with diabetes are using insulin. So in terms of people with type 2 diabetes, approximately 320,000 are living with diabetes and using insulin. The prevalence of diabetes is actually increasing in Australia. We estimate there are roughly 25% of all people visiting a healthcare professional has diabetes. So it's really important that all healthcare professionals understand diabetes to provide that consistency of messaging, because we know that helps people manage their diabetes better. We provide education for all healthcare professionals, and this has changed over time. So diabetes management is constantly evolving, and medications are becoming more sophisticated, and so are technologies. Technologies are relatively new to manage diabetes. So the landscape is constantly evolving, and our education and credentialing programs evolve along with those changes, because our members, being specialists in diabetes education management and care, need to be up to date with the latest that's happening in diabetes. So one of the things we've done more recently is introduce micro-credentials for healthcare professionals. The idea of these micro-credentials is that all healthcare professionals need to be upskilled in diabetes. Many of them don't cover diabetes very comprehensively in their training. So it's really important that they understand diabetes to provide consistent messaging to people with diabetes. We know that when one health professional says one thing and another one says another thing, it's confusing for people living with diabetes and they can disengage from their care. But when there's consistent messaging and understanding across healthcare professionals, it supports people living with diabetes to manage their diabetes optimally. The National Diabetes Services Scheme, also known as the NDSS, is a wonderful government program that provides subsidised products and services for people living with diabetes. There are, however, disparities in what is available for people living with type 1 diabetes and what is available for people living with type 2 diabetes. Diabetes technologies are relatively new. They've been around for around a decade in Australia, and they include automated insulin delivery devices and continuous glucose monitoring systems, also known as CGM. And CGM is a technology that enables people to monitor their blood glucose levels in real time and respond to changes in those blood glucose levels in real time, which is critically important for people with diabetes who need to maintain their blood glucose levels within a target range. Technologies are subsidised, or selected technologies are subsidised through the NDSS for people living with type 1 diabetes, but these are not available at the moment for people living with type 2 diabetes. ADA's view is that all people living with diabetes, no matter the type of diabetes, should have access to the medicines and technology they need to ensure they can manage their diabetes optimally. At the moment, this is not the case. People with type 2 diabetes do not have subsidised access to technology, and this needs to change to ensure that they are able to live well with their diabetes and minimise the risks of complications down the track. The technology with the real-time monitoring of blood glucose levels can mean that people can manage their diabetes and respond to changes in their blood glucose levels as they go up or down. Without these technologies, people are much more at risk of hypoglycemia And over time, they will have a much higher risk of developing serious and preventable complications. So in the example of somebody at work or even a student at school, lack of access to technology means they need to resort to finger pricking. Finger pricking can be very inconvenient in certain situations. So there are some jobs where it's very difficult for people to take the time out to prick their fingers when they need to check their blood glucose levels. This can mean they're at much higher risk of hypoglycemia. And hypoglycemia can not only result in sort of shorter term symptoms like confusion, slurred speech and so on, but it can, if the blood glucose levels drop low enough, lead to seizures and unconsciousness. Nobody wants that to happen at work.
I'm Sahar Awais, working as a registered nurse in New South Wales Public Health. I'm a mother of 4 children. I was diagnosed with type 2 diabetes 6 years ago. After the diagnosis of this, it comes with a lot of challenges, like psychological and physical challenges that come with my disease. Some of these challenges include managing blood sugar level constantly, potential of serious complications, heart disease, kidney damage, nerve damage, vision loss. Then I have to make a major life changes in my diet and fitness, which is, I think, is not that much possible with the nursing shifts job. You have to do the rotational thing like morning, evening, night. So it's not that easy for us to cope with such kind of things. Potential stigma, potential social stigma, need for constant monitoring and medication adherence. These challenges can be even stronger in nursing environment and difficult to manage. Nursing has a long strenuous hour with few breaks that cannot be possible to monitor the sugars. These conditions can make it detrimental to my health condition, especially during night shifts. One of my biggest fear is that while driving, I got a hypoglycemic episode, or I'm working, or I'm middle of some emergency and I got hypoglycemic issues.
All Australians are under financial pressure at the moment with cost of living increases. And credentialed diabetes educators, or CDEs, are seeing changes in patterns of behaviour amongst people living with diabetes, including different choices in relation to food. Food and housing are obviously fundamental, and people are focusing more on spending money there. So their diabetes management is suffering somewhat because of this. People are using medications less, which are critical to their maintaining their blood glucose levels within target range. They're using technology less as well. Technology and medications are expensive. Diabetes is expensive. And this is why it is so important for access to diabetes technologies to be subsidised by the government, because they are so important in providing that real-time feedback about blood glucose levels that helps people manage their diabetes optimally.